In many ways, we live in a golden age of psychotherapy. We have terrific evidence-based models. We're learning about the mind and the body and how to work with couples and families. And what's occurred to me, though, in recent years is that we may be overlooking something that is so central to what we do that it misses our attention, and that is therapy as a conversational craft. The building blocks, the materials of what we do are the words we use, the inflections, the nonverbals, the decision about whether to hold back and to listen, and when to say something, how to pace somebody in a conversation, how to lead them, how to challenge them, and that what happens, I think, often is that the difference between effective therapy and effective therapists with whatever model we use and not so effective therapy and therapists isn't so much just how we're thinking about the client and the problems, because that's what we spend our time focusing on, is what's going on with them and what's my model of intervention, but rather what words do we use and how do we use them and how do we pace ourselves. So I think we've been too abstract, if you will, in much of our teaching and learning and training about therapy. When we focus on our models and our interventions, we spend a lot of time on understanding the client and assessment and diagnosis, and not enough on how are we craftspeople who engage in this conversation that has potential to be healing to people. And how can we learn from the micro steps that we take and don't take? We've spent too much time, if we're carpenters, doing the theory of wood, and not enough time on how to work with the wood, how to use nails, how to use hammers, how to be craftspeople. So that's what I'm enjoying talking about nowadays.